in a clinical environment where shared decision making is happening well versus a clinical environment where it's not happening at all? What's the effect on utilization?
Right. So this is a complicated question. There's a emerging evidence base that if you do this well, people adhere to their chosen medication or treatment in a much better way. And it's kind of logical, right? If I've involved you in this decision and you've understood what's involved in making that decision or carrying on with this medicine, you're likely much more adherent to that because you've bought into it, you've invested in it yourself. We know that when people with asthma, for example, learn about the brown inhaler and the blue inhaler and which one to use first, they understand how to self-manage. And so they've invested their ability to titrate sometimes the medication to their needs, but also how to manage their asthma or long-term condition. So in those situations, shared decision-making makes a lot of sense and leads to better outcomes. There's also evidence to say that when you explain to people, do I need a new hip or a new knee? And they understand, there's a lot of work getting back to my normal function after a new knee, maybe months of physiotherapy before I can, work again or ski or play tennis or whatever. They say, well, maybe I'll wait. I'm not quite ready for that yet. So people make conservative decisions when they know what's involved. They act in their best interests.